Real Estate Team, and you were listening to Seattle's Eastside Real Estate Podcast. We're here with Claudia Arregoytia. Did I say it right? Dr. Claudia Arregoytia? Say it again.
Arregoytia.
Arregoytia. That Goitia is really hard, because especially after you try and roll your R's. Arregoytia.
Yeah.
It's awesome. Well, let me do your introduction here. So, Dr. Arregoytia is a functional and lifestyle medicine practitioner, writer, speaker, researcher, and lover of life who sees health differently than many medical providers. During her family medicine residency, she was trained to prioritize hospital and clinic efficiency goals instead of guiding in developing wellness. It was encouraged to treat with pharmaceuticals. Okay, that I'm catching the tone here. It was encouraged to treat with pharmaceuticals because it was faster, easier, cheaper than prescribed, to really address the underlying issues. She became disillusioned, overburdened, and frustrated, and eventually became burned out. Through her experience as a patient with complex illness, she had first-hand experiences with the limitations of this medical system. She knew there had to be a better way. After transforming her health, Claudia founded the Brilliant Health Institute, through which she pioneered a revolutionary new approach to patient-centered health. Claudia understands that vibrant health comes from within and believes that the power of the body to restore health and balance. And she is committed to improving the health system, activating internal healing, and supporting optimal health and longevity through functional and lifestyle medicine. She's devoted her life to the betterment of healthcare for all. She stands for innovation, practicality, and accountability, and against quick fixes and outdated information. Claudia leads by example and inspires others to take ownership of their health through education and self-love. Dr. Claudia, thanks for joining us today.
Thank you for having me.
Okay, so today's topic is my lab tests are normal, but I still feel like crap. All right. So what made you decide to become a functional medicine provider?
Yeah, basically it was my own health journey. Through the rigors of residency, I did develop something called chronic fatigue syndrome. And it was one of those things where you're tired all the time, but nobody can figure out why. And it was a very debilitating condition. And I was basically told, like, okay, you have to accept this new function in your life, this downgraded function in your life, and just go from there. And I just refused to accept that at the time. And so in my journey of finding a solution, I found functional medicine. And functional medicine was the one that healed me. I came back to 10 out of 10. So I can tell you I was maybe 10 out of 10 before residency. After my traumatizing residency experience, I came down to like a 2 out of 10. I just completely self-abused, and I was just not sleeping, just getting calls and delivering babies at all hours of the night. And so anyways, it just destroyed my health. And so anyways, I came back to 10 out of 10 after like a 7-year period of trying to figure things out with specialists, doctors, naturopaths, nutritionists, health coaches. And when I found functional medicine, that was the thing. That was the thing that it was like a light bulb went off, and I was like, okay, not only is this like targeted clinical approach that is targeted, but it's fast. I came back to 10 out of 10 after 6 months, and that's amazing to me. And and I see it now with my clients. I've been working with somebody for a couple of months, and she no longer has high blood pressure, and her kidney function is improving. And this is without medicines or anything like that. It's just coming back to lifestyle, like really addressing the cause.
So if we can go back into your story a little bit, if that's okay. A lot of people are running around, doing a lot of things. They're taking care of their families, taking care of their coworkers, taking care of patients. And, we live in the Pacific Northwest, and we've got this great thing called rocket fuel called coffee, right? And it just kind of pushes us through, right? So do you mind sharing, was there like a compounding effect that made you go from 10 to 2? Was it gradual? Was it instant? Was it weight related? I mean, share with me that.
Yeah, I can say that. Yeah, I think for me it was gradual. I think my personality is, I gotta say, I'm pretty persistent and relentless. Like, I will take it to the next level. Like, prior to residency, I was training like as a boxer. And so I would like copy, gosh darn it. Um, Heavyweight champion Muhammad Ali's training program, right?
Wow.
And so you can imagine it's intense. Like, I would take it to the limit, and I think I did the same thing with my medical career. I would just take it to the limit until finally I just broke. So for me, it was very gradual, and then I realized one day, oh, I'm having issues thinking, like I'm having issues with my memory recall, that I used to think very quickly and sharp. This is a necessity working in this field. And so
Yeah.
it just came up. It was gradual, but I think it was very sudden when I realized, okay, my mind isn't sharp. I'm forgetting things, like my recall is out. I'm not, even though I'm very, very tired, I can't fall asleep. And when I did finally, sedate myself with some Benadryl just to get some sleep and heal, even then I would not come back refreshed. It was really extreme, but I can tell you during that period of time, I definitely put on some weight, because I think I was just in a really difficult time in my life, and I was just trying to find.
You're just powering through. You're powering through,
exactly.
saying, "Hey, the switch will flip." So interesting thought. This device right here, it's called Whoop. Are you familiar with this?
No. What is this?
So I picked this up about maybe a month ago, and it's WHOOP, and it's on your wrist. It's checking your blood oxygen levels, and it also does your sleep patterns and stuff like that. It's given me a lot of insight in strain. So when you're working out, it will tell you, what level of strain you got, but also sleep. And I've kind of been geeking out a little bit about that, because, I too have felt that feeling that when you push, and then you're like super tired, I need to go to bed. And then you can't, right? And then your next day, it's a level of brain fog. It's a challenge. You're just trying to figure out, hey, how do I get the, what happened to the high performance I had? So share with me the functional medicine, what did it look like specifically?
Yeah. So basically, the process is not like a traditional medicine approach, and it's not like a naturopathic medical approach. It's personalized, and it basically looks at all aspects of health. So nutrition, like lifestyle, mind, body. It even takes into account a person's purpose in life, because as it turns out, this is incredibly important. Sleep is incredibly important. I mean, did you know that the Amish are the only people that don't have any sleep disorders? I mean, and that's for a reason.
I believe it. Yeah. I mean, all the noise, the technology of the podcast, the stuff that we listen to. There's a good book called Limitless that I'm reading, and it talked about, you need start with 30 minutes once a week of just nothing. No TV, no phone. It's actually harder than you think, but all of those things are hitting you. So as you develop this brilliant institute, and you're located here on the East Side, right?
Yes, Kirkland.
Okay. What is a typical patient like?
Well, the typical patient is somebody who has fallen through the cracks of the conventional approach, medical approach. Somebody who is just not getting answers from their medical team at all, and somebody who, and even through alternative medicine as well. So that's usually who is my patient. Let's see. Yeah, I think that's the main thing. It's
So you're a trained. So you're resident, and you said you're delivering babies. So what is you're an MD?
Mm-hmm, yes.
And what other letters you got after your name?
So I'm also an ND. So in my journey to try to find a solution, I just was not, I did go back to naturopathic medical school. However, that that helped me slightly. I gotta say, they did help me slightly. However, it was functional medicine that was like, okay, they did the testing and they were like, okay, what you have going on is a hypometabolic mitochondrial contraction. So basically, your mitochondria are not producing energy in the way that they should. And there was I was put on a protocol, and like I said, it was amazing. I have my life back, and I just want to offer that hope to somebody that, if you just got to trust your gut, just really trust your gut, because sometimes these so-called experts might not really know what's going on, because let's be honest, conventional like medicine is behind in the latest research and the latest things that we can do. And so you just got to trust your gut and just know that there is hope out there to find solutions for you so that you can live your best life.
It's interesting you use that term gut, because sometimes gut health is the issue, right?
Yeah, that's like literally a functional medicine practitioners. We believe that all disease starts in the gut one way or another.
Ah, that's excellent. So hence that term. So that's what I was going to ask you is when treating, what are the type of therapies that are part of your system?
Yeah, so a lot of it is going to be lifestyle, because that's what it comes down to, is lifestyle. So if you provide a healing foundation for the body, optimized sleep, optimized nutrition, optimized mind-body therapies, because a lot of that is provoked by excess stress. Excess stress is going to cause increased inflammation. Increased inflammation is going to cause cortisol to be released, and it's like a never-ending loop. And then once that increased cortisol gets released, then insulin goes up, blood sugar dysregulates, and then all of a sudden you're gaining weight, and then on, and it's just a never-ending circle. But yeah, so most of it is going to be optimizing lifestyle. And I think that the other component of what kind of patient is going to be more suited for functional medicine is somebody who's ready to do some radical things with their diet, because that's what it comes down to. Like, are you willing to, let go of some gluten here? Because if that's what it's going to take, you know what I mean? So that's, yeah. So that's what, and it's just amazing because, that's the kind of person that is kind of suited for functional medicine, is people who are ready to make those lifestyle changes. And then, of course, there's also supplements. Some people just have needs. Entrepreneurs, like they have a higher dopamine need. So obviously, somebody like this is going to have a higher need for supplements that enhance dopamine. So like tyrosine, things like this. But it's very individualized in terms of like what supplements are needed for this particular individual, what genetics do they have, things like that.
Can you supplement with dopamine?
Oh, no, I mean, supplement, do you mean like a natural way?
Yeah.
No. No, well,
just the likes on my Instagram channel, right? That's my dopamine supplement.
Oh, okay. No. You can take tyrosine as a precursor to dopamine. So if you make sure that you're getting enough protein in your diet and that you're actually assimilating in your diet, because sometimes people are so stressed out that they're not digesting their food properly. So that's another thing, because you need to be in a relaxed state to digest food, and so. A lot of times that's what it is. However, yes, taking tyrosine supplements can help with the entrepreneurial crowd for sure.
No, I love that. And honestly, for me, I do try to kind of heavier on the protein and as low on the carb as I possibly can. And I have to say that we do a really poor job in the world switching the menus over to a higher protein diet. Everything is so loaded with carbs, and it doesn't really have to be. But if you're busy, you're on the run, and you go grab a burrito, well, you've got rice and you've got the burrito thing, and all that just blows it away. So you can do like the burrito bowl and skip the rice. But it's one of those things that I would say it requires accountability, which is partially part of your program. Yeah.
Yeah, definitely.
Okay, so what is your opinion of chronic disease? Do you think they are reversible?
Oh, 100% reversible. Yeah, I think, well, chronic disease is usually caused by lifestyle. So if you're able to optimize the lifestyle, in most cases, you're able to completely reverse disease process. You can completely reverse things like diabetes, things like I was talking about my client or patient before, blood pressure. She's no longer hypertensive. So yeah, I think it's completely reversible. It's because the cause is lifestyle. So if you change your lifestyle, you can change everything. It's a matter of what signals are you sending to the body, right? And that's everything. The way you think, what you eat, the movement that you're giving your body. How are you nourishing your body? And so, in those ways, I think healing is just bound to happen. And so, yeah, completely reversible, definitely.
Now, lifestyle requires it requires the individual be motivated and disciplined, and and have a big enough why to change what they're doing. Right? That's 100% that the mindset side of things. So when somebody's in a spot where they're just not feeling good, right? Sometimes it's this spiral. You just stay in that spot and you figure, well, I can't do that. I can't do this. I can't go work out because I'm not feeling great. So somebody coming into your world, what does that initial visit look like? And how do you get somebody from that spot to actually changing lifestyle? Because I would say maybe it's not true for everybody, but many of us are out there going, well, I know what I need to do. It's just hard to do it.
Yeah, no, I was right there with you. I mean, I was right there with you. So I think, I'm very particular on who I take on as a client or a patient, because that's what's needed, is somebody with an open mind. I might be recommending some weird things. Some
Like what?
Like, for example, that we're in excess of sympathetic mode. That's fight or flight, right? Constantly, a lot of stress all the time, and it happens. It's like waiting for the shoe to drop, and so the healing can't take place unless you're in parasympathetic state, which is rest and digest. And so, anyways, I might recommend you to scrape your tongue and and gag almost, because that is like strengthens the vagus nerve and henceforth the parasympathetic nervous system. So you have to be willing to try some wild things to get to get healthy here. But
well, scraping my tongue, that's fine, but I thought you're going to make me jump in an ice cold vat of water first thing in the morning or something like that. I'd still try that, because I hear that's pretty good for you too.
No, that's pretty good too. I mean, that's excellent for health. I haven't done that myself, but I do the cold water rinses in the shower, so that's great too.
Yeah. Well, this is all interesting. So, how do you work with folks, and how does this process work?
Well, first I would have. First, I would accept you as a patient, and then we would do a full intake, a full thorough evaluation. From there, we would create a personalized treatment plan that addresses the underlying cause of the health issues. So that's taking into account, how you were birthed, like, were you breastfed? How many times have you taken antibiotics in your life? Where have you traveled to? I mean, it's pretty in depth.
Wow.
And then I would integrate that information and find the root cause and go from there. And then, of course, I would utilize therapies like nutrition, supplements, lifestyle, mind-body medicine, and we create comprehensive and individualized approaches. And we also monitor the patient very carefully during this time, because lifestyle is definitely it's one of those things that it's you need coaching to do these things. And I know for me, one of my things was, I'm too busy to cook, right? I'm too busy to cook. Well, in a scenario like this, I can teach somebody how to cook. So I I can coach people through the roadblocks that they may be having in changing their lifestyle. So, my goal is to empower the patients to take control of their health and achieve optimal wellness. Basically, I hope that they become their own doctor and no longer need any of us.
Nice. So it's not just about a treatment plan. It's not just about a subscription to a coaching, but it's about having an understanding, educating your clients. And something I heard you say when we first met is you're not looking for people that aren't motivated for change, right? If they don't have the determination, and you said that again today, they aren't a good fit for you. If they are at their wits' end and ready to have that lifestyle change that can impact their lives in a positive way, then they can reach out to you. Where is your practice at, by the way?
Oh, it's in Kirkland. So it's at 515 Kirkland Way. So
515 Kirkland Way. So that's like downtown Kirkland?
Yes, exactly.
Awesome. Very good. Well, Dr. Claudia, I so appreciate you coming on today. I'm not going to keep trying to butcher your last name, but can I call you Dr. Claudia? Is that okay?
Of course. Everybody calls me Dr. Claudia, actually.
Okay, good. It's good. I mean, it's fun, but I keep slaughtering it, so I don't want to do that. Thanks for joining us today.